Good morning or good afternoon to those of you in the Eastern time zone. Welcome to the first webinar ever for the Award Network's Pilot Award Program. This webinar is being recorded and is also closed captioning is enabled. So if you prefer to use closed captioning, you may. And we will be posting this recording on the Award Network website for anybody who's not available to be here, or if you want to go back and read items again. We also, from any questions, can put together a frequently asked questions component of the website or the web page for the Pilot Award, so that you can take a look at that later if you don't remember the answers to every question. So I'm Joanne Spetz. I'm the principal investigator for the Award Network, and I am leading the Pilot Award work. If you have any questions as we go through the webinar, please put them in the Q&A, and I'll be keeping an eye on that, and feel free to put in your questions whenever you want. If they're kind of immediate, I'll answer them right away. Or if they're more general, then we should have plenty of time at the end of the hour to answer all the questions that you might have. So first, I think probably all of you are on our mailing list already. So who is the Award Network and what are we doing? We are a project funded by the National Institute on Aging to create a strong community of researchers focused on the workforce that serves people living with dementia. And this network is based at the Institute for Health Policy Studies at UCSF. That's kind of our headquarter location. But we also have partnerships with other organizations, which I'll talk about in a minute. This program is essentially a 5-year program, and there is a long link here if you want to read the overview on NIH Reporter and the project number. So if you want to go look up the abstract online, you're welcome to do that. So the leadership of the Award Network is myself, and then Susan Chapman and Laura Wagner, who are here at UCSF with me. Susan also is the deputy director or co-director with me of our HRSA-funded Health Workforce Research Center on Long-Term Care. And Laura Wagner is our associate director for research for that Health Workforce Research Center. Bianca Frogner is also part of our leadership team of the Award Network. She is the director of the at the Center for Health Workforce Studies at University of Washington. They have 2 HRSA-funded centers there, and one focuses on the allied health workforce, which clearly has a lot of overlap with long-term care, so we collaborate closely with them, as well as health equity and in the workforce, and so that is her area of work. Finally, Kezia Scales, last but absolutely not least, Kezia Scales is at PHI, and she directs their research program at PHI, which is a national organization focused on the direct care workforce. So that would be home care aides, nursing assistants, generally individuals who are able to provide direct care to clients and patients, but without much or any formal training. So what do we do? So the Award Network has a bunch of activities underway, and we have an annual meeting in conjunction with other national conferences. The next one will be at the Academy Health annual research meeting next June. And then we are planning to also do something at the GSA meeting, which I think is in Seattle in 2024. For the GSA meeting in 2023, I think some of us will be there, and we encourage people to get together, but we won't have a formal conference because we just did the American Geriatric Society as our inaugural conference. We have monthly virtual trainings, webinars, and workshops. The monthly webinars have been really well attended, and the webinar committee has just made plans to cover most of this next academic year. So watch the website because those will be up soon. We're going to have 2 summer training institutes. The first one will be next summer, 2024. We will send out a save the date. It will be limited attendance for the summer training, and there will be travel stipends provided to support the travel for those who apply and are admitted to join the institute for the summer. We also have competitive research internships and are beginning to craft the call for proposals for that. And what those are basically are funding for award member participants to spend a couple weeks, 1 or 2 weeks, whatever their budget allows or whatever they propose, visiting colleagues or potential mentors to work together to launch new projects or develop a stronger mentorship relationship or whatever is appropriate and proposed. So we're kind of crafting that now, and that call for proposals I think will come out later this year. Directly fund pilot research, which is what I'll talk about today. And then finally, we are in the early stages of developing resources that will be on our website to bring together data to facilitate your research and accelerate your research. So you don't have to spend as much time running around looking for various data sources that you might want to use. You'll have a single place that will provide a high-level overview to help you narrow down. And in the long term, we hope to have a compendium of data that describes different policies relevant to the direct care workforce, so that you might have a whole bunch of control variables and other policy variables ready to go for your own research. But without further ado, let's focus on pilot awards. The pilot awards are intended to support early stage research on the workforce that serves people living with dementia. And that research is defined pretty broadly. It can be quantitative, qualitative, it can use mixed methods, it can be local, national, regional. It can really focus on any topic related to the workforce and care for people with Alzheimer's disease and related dementias. And in preliminary data is welcome to be included in these pilot award proposals, but certainly not required. A fair amount of the purpose of these proposals is to help support you in gathering preliminary data. So these awards can be up to $20,000 total costs. We've allocated $40,000 in this budget cycle. So normally we'd expect that to fund 2 awards. But if we have a couple of really meritorious awards that are, say, $10,000 each, or we get 3 award proposals that are, $12,000 or $15,000 each, we might be able to fund 3. So it just depends on what the proposals are and how it all falls out. We're assuming it'll be 2 this year. Note that we are encouraging direct costs at 8%. That is included in that total cost $20,000. Your institution may choose to use its federally negotiated rate, and we cannot tell your institution to not do that. So we can't give you extra money if they do that. So we encourage you to go talk to your institutional grants office right away and try to get them to agree to an 8% rate. That is, this language is kind of approved by our grants office, and reading the award requirements for us carefully. If an institution wants to request the federal rate, that would be totally compliant with the policies of the federal, of NIH. However, it is also within our purview to request a lower indirect rate. And given the small amount of money here, we don't want to see half your budget eaten up with indirects. So that's that hopefully explains that a little bit. So the priorities for this RFA on this cycle are projects that focus on the direct care workforce. However, research can focus on other professionals, but in the end of determination, we will prioritize studies that include direct care workers. So if it's kind of like 2 projects or proposals score almost identically and one includes direct care workers and one doesn't, then we would prioritize the direct care worker one. But if the direct care worker one scores a lot lower, then it won't get prioritized or necessarily rise to the top. So we do encourage you to think about interprofessional teams, interdisciplinary teams that you might be studying. If you really want to look at geriatricians, that's cool. But we would encourage you to think about whether there might be opportunities to incorporate some component of your project on direct care workers. So how do geriatricians work with direct care aides, or do they ignore them? And so on. Aims specifically related to health equity and or health disparities will be prioritized. Projects that are designed to help you collect data and research skills needed to submit a really strong NIH-K award or R award level application. And so if you have a project idea that really aligns well with NIA priorities, which you can look at their website to find what their current priorities are, that kind of research that would really help facilitate a larger NIH type of award, or maybe PCORI or another agency, is really encouraged. And we also are welcome to take applications and fund individuals of any rank or any level in a US-based institution, but we will prioritize in the end early stage investigators. So some examples of the kind of research that we expect we might see in our proposals, and I just totally made these up. So maybe doing a small research project on home care aids that are going to produce preliminary data for a larger proposal. Maybe you're pilot testing a small survey or pilot testing an interview protocol, or gathering some preliminary data just from one city, and your larger proposal later would be a multi-state or a longer interview protocol, or kind of building out that preliminary data into a larger proposal later, but this is a pilot study. Writing a new paper from an old study also could help, align with this RFA, especially if you were, say, writing a new paper on old data and you were bringing in new co-authors because you wanted to submit a future proposal with those co-authors. And we know in study section reviews that there often is some discussion and there's some scoring around the investigators. And if the investigators have never worked together before, sometimes the study section dings you for that, for not having an established collaborative relationship. So establishing those relationships to lay the groundwork for future proposals would be in scope for this RFA. Gathering preliminary data specifically to prepare a proposal also would be in scope. And also doing focus groups with community-based organizations to establish community relationships for community-based participatory research would also be well within scope. So these are just total ideas that I made up, a few days ago or last week. This is not meant to limit you in any way, shape, or form, but just to give you a sense about the kinds of things that we anticipate we might see that could fit within a $20,000 budget. Eligibility is that you need to be an Award Network member, and you can sign up on the website right away. So this should not be a barrier to you. If you're not a member now, go sign up. If you have a colleague who's interested in applying for this, just have them sign up so that when we look at the database, we see that your name and email is there. Let's see, you need to have a doctorate, and that could be a doctorate really in any field, PhD, clinical doctorate, whatever. You need to hold a position, as I said, as faculty, research scientist, postdoctoral fellow, something along those lines. So you could be a research scientist in a non-university setting. You do not have to be a US citizen or a US permanent resident. That is not required. But you do need to be in a US-based college, university, medical, or nursing school, or other fiscally responsible organization. So a lot of research organizations like RAND, RTI, WestStat, et cetera, would qualify. Basically, you need to be in an organization that is eligible to apply for an NIH grant, and you're pretty much eligible for this program. And we really encourage applications from populations underrepresented in the US biomedical, clinical, behavioral, and social science research enterprise. And there is a link in the full RFA on the website about how so you can go see how that's defined by NIH. So how to apply? Okay, first things first, deadline end of October. I know that's fast, but these are small proposals, so hopefully that won't be too big a lift. We would like you to submit the application as a single PDF by email, and the email address to send it to is in the RFA. You can also send questions to that same email address, which basically I access and keep an eye on. We want the application as a single PDF, and it has 5 different key components. There's a cover page, and there are directions for that. There's a proposal body, which is a maximum of 3 pages single spaced, and the RFA has font size and margin expectations. So you don't get to send me 3 pages in 8-point font that I can't read or none of the other reviewers can read. You have to send it in a font size that we can read. Budget and budget justification. For the budget, we want you to put that in NIH format. And there is a pointer to the place on NIH where you can see what that format is. The odds are really high that your contracts and grants office at your institution is very, very familiar with that format. So that hopefully will not be too big a lift. A bibliography is not counted in your proposal body page count, but if you did cite anything, you need to include that bibliography for us. And then National Institute on Health style biosketches. And there is a link in the RFA to what that format looks like. These are good things for you to have prepared if you're an early stage researcher. This is something that you're going to end up needing over time. So it's as good a time as any to put one together. So for the proposal body, again, 3 pages, single spaced, we want 6 sections in this. We'd like you to speak to the study aims. Why is this study potentially important? What are your goals? The significance of the study. So, the aims of the study are X, Y, Z. You don't need to have a full aims page as a NIH grant would require, because that would eat up a whole page of your proposal. So you can be very brief in getting to what your aims are, and there might only be one aim. That's okay. You need to explain why this is significant in general. Why are you addressing a important area of inquiry? Maybe you're going to test new approaches to doing interviews or focus groups. Maybe you're going to collect new data. Maybe you're addressing a policy question that's really important. There are a lot of different ways that your work could be significant. Is it innovative? And you can talk about, this might be the first study that ever does blah, blah, blah. Or, we're going to use tried and true methods, but those methods have never been used to study some particular issue. Then you describe your approach, and this area is probably where you should spend most of your page space of how it is you're going to do your research. What is your research plan? Who might be involved in that? Kind of what are the different roles? Are you doing data analysis? Or are you doing interviews? Are you doing mixed methods? Kind of what is your plan? Briefly describe your research team, because many of you work in collaborative teams, or you might have mentors that aren't part of your budget, but are going to provide support to you as part of your research team. So feel free to describe your mentors here or any collaborators that might not be in your budget, as well as people who are in your budget. If you have a staff statistician who's going to help support you, please describe them so that there's a sense that you have a group of people surrounding you, between you and your team, that you can do the work that you propose to do. And then finally, future aims, which is basically, describe how this pilot project positions you or will produce data that will potentially lead into a new proposal, a larger body of work in the future. Kind of where will this pilot work go into the future? And so that's where, if you're thinking this is pilot work for a K award or for a PCORI grant or whatever it is, this is a great place where you get to describe that. So to return to the budget specifications, $20,000 total costs. You can use this for personnel. You could use this for travel, publication fees. You can include that for open access publication, data collection and purchases, research related supplies. Those are all totally fine. And as I said, you can include indirect costs at 8% of what NIH would call modified total direct costs. But your institution, talk with your institution about what they want to do. I'm hoping that your institutions will let you keep as much of the money as possible for research. But since this is a federal primary grant, it is their purview to say that you have to use the federal rate for your institution. So how are we going to score these things? So we're actually going to use an approach, kind of an abridged NIH study section type of approach. And so we have a panel of reviewers that I will share information with you about who they are in a couple minutes. And we're going to ask everybody to rate proposals on a 1 through 9 scoring system like NIH uses in these different domains. The importance of the research question and including the potential of the project to lead to a larger project that has importance to the people who live with dementia and the workforce that serves them. The innovation of the project, the inclusion and quality of any aims related to health equity and disparities, the inclusion and quality of any aims that are considering the direct care workforce, the feasibility and rigor of the project, the expertise of the investigator relative to career stage. So if you're a postdoc, we expect that you are still in a training stage of your career. And so that would be the expertise we would be looking for. If you're a full professor, then we would expect the expertise demonstrated in your biosketch to be different than a postdoc. Preparation of the team overall to do the work. This is not a K award with career development and training built into it. And it's, these are pretty quick 1-year projects. So, please convince us that your team can do this and you have the right training for whatever you propose. And then the likelihood that the project would lead to a larger proposal. NIA would love to see more K and Rs associated with their notice of special interest in the workforce that serves people living with dementia. But if what you have in mind is a community-based participatory study that you think PCORI would be really excited about, that's cool. It doesn't have to be an NIH proposal. So the selection committee is provided here. Anybody who has a conflict of interest will be recused from the study section review and reviewing the application. So we will be asking everybody to look for conflicts of interest. So if you're, a co-author of LaTanya Trotter's, you can still apply. That's fine. Just we'll, not let LaTanya read your proposal, and we'll kind of kick her out of the Zoom room when we do the reviews, just like NIH would do. So don't worry about that, and we will, don't let that be a limiting factor. But this is the committee, and much as NIH, please do not approach committee members directly to lobby for your project or to have any communication about your project. We don't want people to be in a conflict of interest situation because we are trying to really provide a fair review and an open review for all individuals who might be interested in applying and want to be competitive for these projects. The top scoring proposals we are going to bring to our advisory board for guidance. There's a link there to our advisory board, very easy to find them on the website. And that is a group of people from various national organizations, including we have 2 representatives who are direct care workers with lived experience in the field. And so we are going to bring the top scoring proposals to that group and seek their guidance about which ones they view as the most significant and the most important and that really excite them. Because it's very important for us to have the voice of the population that we aim to serve, the workforce and people living with dementia in the room. And so the representation, we hope, will be able to represent that voice and that priority. And we will provide, as I said, additional consideration and prioritization to people at an earlier stage of their career, people from groups underrepresented in the social sciences and general NIH research enterprise, and of course, people whose broader research interests and career interests align with the overall goals of the award network. So that is my overview. Here's the website where you can send questions, or the email address, and our website as a reminder, and we will be sharing this video and any Q&A that comes in by email, we will share there as well. But I'm happy to take questions now. I'm keeping an eye on the question and answer and haven't seen anything come in yet, but please type your questions there. And I'll stop the share. All right. So we have questions, yay. So is there a limit of the number of proposals someone can participate as a PI or co-PI? No, I don't think we have a limit on the number of proposals. Although, just having been through proposal writing before, I do encourage you to not dilute your time too much. Submitting one really great proposal is probably better than submitting two mediocre ones. And I think co-PIs from our perspective should be fine, although somebody will need to be the official point person for a subaward. And, because we will be issuing subawards to your home institution. And so much as for NIH, you can have a multiple PI project. One of those people needs to be the official person of the multiple PI project. Let's see. On the first page, the due date is October 29th, and then which day is it? I am sorry about the inconsistency. I will double check on that, but if the RFA says October 29th, then the printed document would be correct and my web slides here would not be correct. So whatever it says on the page, on the document. And I think we said like 11:59 p.m. Pacific time, which basically means that Monday morning, we want to be able to compile the proposals that have been received, assign them to the reviewers, and our intention is to give the reviewers a full month so that they are not rushed in reviewing your proposals. And we are going to be doing those reviews in, I believe it's the first week of December. We will be doing those reviews. Maybe it's the last week of November. And then, let me see here. I'm double checking the dates. Yes, we are doing them the week after Thanksgiving. We are going to review these. So we want to give everybody enough time to submit them, given that the Thanksgiving holidays are in the middle of all of this. And then we're going to have the advisory board meeting, hopefully early in December, so that we can let you know before you go away for the winter break, if you're an academic institution, what's going on. Let's see, on proposals from institutions, we have no limit on the number of proposals from institutions. So, there's no limitation there. If the best proposals are coming from the same institution and the advisory board recommends it, then so there's that. Oh my gosh, and thank you so much, Cynthia. We have different deadlines on the RFA. Okay, well, since we have different deadlines on the RFA, we will correct the RFA and we will make it October 30th to give you the extra day. Plus, your institutions might be happy to have that Monday to finish compiling things and sending them in if it needs to come from your official grants office. So let's see, Jing, secondary data analysis is absolutely eligible. So if it is a subset of data that you already have, or if you want to do some analysis with NHATS to help prepare your proposal idea, that is totally fine. It could be secondary data that you've collected directly, or secondary data that is collected, from the Census Bureau or from some other survey data. Analysis, that's totally fine. So let's see, I think I got all the questions so far. No, I didn't. Sorry. Emerald, would I consider nurse practitioners direct workforce? The direct workforce, we define for the purposes of this, much as PHI defines them, and that is the lower wage roles that are directly involved in care and typically do not have formal post-secondary education. They may have a certificate like a CNA does, but there is not really any degree requirement or licensure requirement. So from that prioritization standpoint, nurse practitioners, although they do provide direct care, they don't fall into that direct care workforce definition that PHI uses. That said, a study about nurse practitioners' roles in providing dementia care can be very important and may score very well when all is said and done through the review process. And nurse practitioners also intersect with these other professional groups. So if there is an opportunity to think about a project where you're looking at nurse practitioners and their relationships with or delegation to or existence on the same team with other providers, and maybe how that relates to quality of care or just job satisfaction or turnover or anything else, that would be most welcome. Let's see, other questions. If you don't have access to the secondary yet, is the project still viable? Ooh, that's a good question. I mean, I think you need to make the case that the secondary data would be available at the time you would begin the project. And, it'll take a few months for subawards to be issued. But, but if there are some data sources where we could have concern about that, so I think you need to make the argument that the data source would be acceptable. A great example would be the National Sample Survey of Registered Nurses is supposed to be coming out this winter. And that is going to have some really great data about registered nurses and nurse practitioners. The questionnaires are available. There's a lot of information about what's going to be in the data, but it's not quite released yet, and they haven't announced a firm release date yet. Do I expect it to be out by April? Yeah, I think we all expect it to be out by April. But, so that would be an example of a data set that I think we'd say, yeah, okay, we believe it'll be out. But if it's, so just you have to assess the risk of the data set not being out and kind of make the argument that it should be ready on time. So let's see, another link. Oh, thank you, Kalal, for becoming a member. And then that's all you need to do is just go in and fill in the survey. And then every week or two, I download the new applicants and add them to our mailing list. And there you go. You're a member now. Thank you. Happy to have you in. And that will also get you on the mailing list for all the webinars and the Summer Training Institute and the other professional development opportunities that we're putting together to try to accelerate research in this area. So other questions? All right, we might be running out of questions. I'll give it another minute or two to see if any other questions come in. And this is our inaugural pilot award. So, we hope that you will be patient with us because we're trying to figure it out. We've not done this before, but we're excited that we are able to do this and are hoping that and we'll be doing this every year for the next few years. So if you miss it this round, we are planning to do this for, there will be repeated pilot award opportunities over the next few years. So I'm seeing no other questions come in. Feel free to email me directly and we will correct the RFA and the website to indicate that October 30th will be the deadline at some late hour Pacific time, so that when we come in on Tuesday morning on Halloween, we are ready to compile all your proposals and get them out to the reviewers. Feel free to email any questions to me and directly to the Award Network mailing address. And we will share questions and answers on the website as we have them come in, including the ones that came in the Q&A here. And I think I hit all the questions. So I think we are good for the day. Thanks for joining us. It's, let's see, one other thing. Do we get feedback for future applications? Yes, we do want to provide feedback. And we will create kind of an abridged form so that you can get some feedback. And we will try to create kind of a summary of key points for you. And then, then after the process, I'm more than happy to meet with anybody to also talk through the proposal and kick around other ideas. Because even if this pilot award is not something that you were awarded, there may be other venues that we could think of that would be really good for your award or for your idea. So looking, let's see. Hey, Roy. Let's see, encouraging underrepresented researchers to apply. How do we capture this information? This is something that I think you could include in your bio sketch. That's often where I see this kind of information presented. We don't really have a checkbox per se provided for that. So I think if you believe that you fall into a group underrepresented in medicine, whether it's that you have a live with a disability, or you are from an underrepresented minoritized racial ethnic group, or whatever, or a veteran, or whatever the different categories are that NIH notes, please do point that out in your bio sketch, that is part of your identity, and that will be important for us to be aware of. So thanks for asking, Roy. Yeah, we don't want to make assumptions about what identities people hold, and some identities are not visible. So we do want to make sure that people feel empowered to point that out to the reviewers. And we'll note that also in a question and answer part of the website. All right, I'm gonna stick around, keep an eye out for any other questions for another few minutes. And thank you all for coming. Really appreciate the interest in this. And we're looking forward to seeing the proposals that come in. I think there's a lot of really cool research that can happen from this. All right, seeing no other questions, we'll end the webinar now and the recording will be up soon. Thank you for attending. Bye.